Hello everybody, warm greetings from Dr. Priyadarshini. Today will be a series on patient stories. Let's hear out a few interesting cases that I have encountered in my practice for facial trauma. Facial trauma यानी चेहरे पे चोट लगने के कारण हड्डी का टूटना या फिर सूजन आना, रेडनेस होना जिसको हम बोलते हैं ब्रूजिंग होना. I'll be sharing with you few instances right from teenagers who have come with accidents to oldies who have fallen out of their home out of not able to see or slipping somewhere. So let's hear out these stories and we'll conclude with saying that all of these stories are very different. However, the treatment, the management remains the same. एक patient आया मेरे पास, all of 19-year-old, a young boy. बोला मैं टू व्हीलर एज इन वो बाइक पे था, जा रहा था एंड ही हैड अ फॉल. आया, बहुत पेन में था. बोला ऊपर के 2 दांत पे डायरेक्ट चोट लग गई क्योंकि वो मुंह पे बल गिरा. एंड व्हेन आई एग्जामिन्ड हिम, उसके 2 दांत were little shaky, meaning mobile, moving a little bit, and he was in tremendous pain, not able to bite, not able to chew food. खाना नहीं खाया था जब तक वो क्लिनिक पहुंचा. वेरी कॉमन इंसिडेंट आपने आपके आजू बाजू में सुना ही होगा या देखा होगा. One more incident. So there was this 65-year-old lady all alone at her house, and she had a fall. She had a slip in the bathroom. Very common thing, especially encountered by aged people. And what ended up was she fell on her chin. Now her mouth is not closing. Unfortunately, she had very few teeth also. When such cases come, the first thing that I as a doctor or you as a patient have to do is get it to attention, bring it to notice. आपके nearest clinic पे जाइए, hospital पे जाइए. Reach out, seek help. We are most welcome to hear out your queries, your concerns, and we'll get the solution for you. Thank you.